My name is Nicodeme. I am originally from the Democratic Republic of Congo, where I trained as a family physician and moved to Canada about in 2008. I got involved with community matters around about 5 years ago. And initially, the way I was involved is I was really looking for something. I've been working in the banking industry from Calgary to here, and it was really an area where I was not really comfortable. It was not my element. So coming here, I joined as an observer just to see how it is done. And I ended up learning so much and having an experience that really changed my life for the better. And it changed not only as a person, as a professional, but financially also. The IEHP program, Internationally Educated Healthcare Professional Program, it really has that choose a different path. It's the way to help internationally educated professionals to have alternative careers using the skills that they have acquired and they have within them, but that are just buried because of the frustrations that they've encountered throughout their journey to integrate in Canada. From family physician, radiologists, anesthesiologists, people who are psychiatrists, people who've worked in nuclear medicine, people who have worked as psychologists, physiotherapists, nurses, many specialties that are really so essential and were and still essential in medicine. So we help them with the tools and techniques to really bring the best out of them and be competitive on the market, as many Canadians who are already established are doing. And we help them to make sure that the transition, the road to success in Canada is much more clear and much more smoother. One of the examples I can start with is just within the St. James town. We've had a number of professionals, psychiatrists or family physicians, people who have worked in the public health area, who have come here and have seen that value in applying the same kind of skills to the Healthy Living program in terms of public health service, like communication, in terms of getting involved with diabetes screening or blood pressure, high blood pressure, hypertension screening. I know a radiologist who came from Turkey, and this gentleman was able to work as a technician in one of the imaging centers in Toronto. Another example, I think it's my own example. I trained as a family physician. I did a lot of work in communication. I did a lot of work to really teach communities how to improve their well-being. And those skills like communication, ended up helping me to secure position in the pharmaceutical industry. Despite all these other problems, the fact that we have employment and we have support within the community, it grounds out. And that, I think, is a major benefit for St. James, because when people stay, businesses thrive, because these people will be utilizing the services from those businesses. And when businesses thrive, the community thrives, the government has taxes that they can draw from people, from businesses. And it's a really win-win situation where people feel safe and integrated, and even the government, if I can go that route, benefits from this kind of impact.